Let me start with Obamacare. In 2010, supporters didn't want anyone to read the health care bill, if you remember right.
It's going to be very, very exciting. But we have to pass the bill so that you can find out what is in it.
Nobody's going to believe, our children and our grandchildren will not believe we flushed the greatest health care system of the world on that. Never. They'll look at us and say, really? You have to pass it to find out what's in it, and you guys applauded? Yes, we did. Now the new law is rolling out, and we're finding out, what a surprise, millions of people are beginning to find out why they didn't want to tell you what was in it. In fact, a new cottage industry, thisismycancellation.com, is a new website. This one actually works, created by the private sector, to show all the cancellation notices currently flooding America. And this is just the beginning. There's a new analysis done by healthcare economist and research scholar at Duke University and also the AEI that says once Obamacare is fully implemented, at least 129 million people will not be able to keep their healthcare plan. That is 68% of all of the insured people in the United States. Look, I have no problem helping people out. You want to help people out, I want to help people out. I want to make sure that there's nobody dying in the streets, right? But 68% of us are going to lose the plan that we like entirely or be forced to pay higher prices for the exact same plan. That wasn't what you told us. In fact, we were promised we could keep our plan and our doctor. Now, let me show you the latest. This is from the Wall Street Journal opinion section, written by a woman battling stage 4 cancer. She says none of that stuff that the president said is true. She said, quote, "My affordable, life-saving medical insurance policy has been canceled effective December 31st. My choice is to get coverage through the government health exchange and lose access to my cancer doctors," imagine that, "or pay much more for insurance outside the exchange. The quotes are 40 to 50% more for the privilege of starting over with an unfamiliar insurance company and impaired benefits." See, this has real consequences. This isn't about the collective. The president wanted to make it about doctors cutting feet off of patients. Well, what about this patient? Well, they'll talk about the individuals when they want to get us all to group as a collective. But once we're all in as a collective, they don't care about the individual. This is what always happens. Not sorry for the extra pain and suffering we caused, not, oh my gosh, let's see if we can fix this. No, instead, how did the White House respond? Accusations and finger pointing. Watch this. Look at, this is Dan Pfeiffer. The real reason the cancer patient writing Wall Street Journal lost her health insurance. And it comes from Think Progress. Well, really? What do you think Think Progress, the progressive group, is going to say? Of course, they blame the insurance company because the insurance company canceled her. Why did they cancel it? Why can they not provide that anymore? Why is it 50% higher? It's comical when you really think about it, if it wasn't so tragic. Then the New York Times provides cover for the president. Not surprising, but this is, again, look at this as history. Come back 50 years from now. Show the New York Times. This editorial is they're covering for one of the most clearly provable lies in all of presidential history. They call an overblown controversy. Claims the president clearly misspoke. About what? Well, when he said you could keep your doctor, you could keep your insurance. He misspoke? Even more unbelievably, in the same column, the New York Times admits that Obamacare will cause health care premiums to rise. They also said it would go down. Remember, affordable health care? Premiums may well rise, in part because insurance companies must accept all applicants, not just the healthy. We said that and they mocked us. While some will have to, quote, buy policies providing more benefits than they want. Why do I have to buy something I don't want? For instance, maternity care. Well, if I'm a guy, I don't need maternity care. If I don't have children, I'm flushing that money down the toilet. The administration and the press are in complete sync, both of them aiming guns at the insurance industry. That was their plan from the get-go. The president did not misspeak. He knew this was coming. He knew he was going to pass the blame on to the insurance companies. It has been well crafted. They will blame the insurance companies, and they will also blame Congress. Oh, well, they changed some things. I didn't have that in mind. Remember? Well, you got to pass it to find out what's in it. Well, we'd know, wouldn't we? The president knew exactly what he was doing.